Greetings, good afternoon, good morning, and welcome back to the Grounded Bag podcast. I am your host, Aisha Ensa. And if you have not already planted roots with us, please do so right now. Subscribe to this YouTube channel, like, share, and comment so that way YouTube knows that you find value in this content. And most importantly, share it with whomever you think needs this because we're going to be touching on a very important subject matter today. But I'm not done yet. If you have not already, please go ahead and listen to the Grounded Bag podcast on Spotify and all streaming platforms so that way you are not out of the loop of the exclusive content that we will be dropping digitally and audibly. And the most important thing that I want to make sure that we are just tagging in and touching in is resetting. If you're watching this, it's Friday. It's been a week. Ooh, it's been a week. We have overcame and we are here. So let's take this moment to reset and we'll be back with more.
So let's begin in a comfortable seated position. Allow your sitting bones to press down into the earth. Roll your shoulders up, back, and drop them down. And slightly lengthen your spine. Gently close the eyes. And imagine there's a beautiful, vibrant, shimmering white light all around your body. And as you inhale, you take this light into your body. And exhale, let it go. Inhale the love. And exhale everything else. Inhale calm. And exhale anything you're holding on to that it's time to let go. Beautiful. Enjoy your day.
Yeah, that was amazing. That was relaxing. That was a reset that I needed. And welcome to the resource room. Yes, you got to reset so that way you're able to really take in this experience. And on a previous episode of the resource room, we were talking about burnout and we were also talking about resources that would be supportive of burnout, but as well as the resources that are there to really provide that workplace anxiety, life anxiety, and just overall that debrief. Because the most important thing that we really need to be mindful of is how our environment and how our work interconnects, because it's all connected. And the most important thing that I also want to remind you all of is, in light of everything that's been happening in the world, but also in the social media streets, and also with everything that has been happening, even with the doctor who claims herself as a doctor, Cheyennebryant. I think it's important that we really have a candid conversation about really honing in on our mental health and taking it in our own hands, but also just being mindful of how to verify your clinician's license before you trust the process. Because even if you're an LPC, even if you're an MSW or an LCSW or a doctor or a practitioner of health or mental health, you are still held to a standard. So that is why I want to introduce that segment as part of the resource room, because not only do I think that it's also going to offer a lot of value, but we're also going to be talking about states like Virginia, Georgia, Florida, and California, plus the nationwide guide on how you're able to look up the license of your practitioner and all of the steps. Because as a client, as a patient, as an individual who deserves the truth, you should be knowledgeable of what's happening. Because I am an MSW student with Howard University in my final term, and once I'm able to obtain my green light, I will be sitting for the board exams for my state, and I will gladly post and share my license number so that we can look me up, get that verification with the state, see that it's a board active and anointed and appointed. And the most important thing that I really want us to really focus on is before you open up your trauma, your story, or your healing journey, it's important that we need to be and hold sacred is, do you actually know if your clinician is licensed to hold it? Are they even licensed? Are they even accredited? Or do they even have the knowledge that they claim to have? Because you can be an encourager, you can be a counselor, you can be a case manager. But if you're going to call yourself or be a therapist or a counselor of mental health, you need to have your credentials, your legible credentials that I can look up, because I'm putting my trust in your hands. I'm putting myself in your world for a moment and I'm being vulnerable. And the saddest thing is that with a lot of these incidences of inconsistencies with licenses and who's accredited and who's not, it does put a damper on, okay, am I going to be treated fairly? Am I going to have the regard of a clinician that's going to respect me? And it's going to put a question mark on every single clinician in the field from here on out. Sadly, some clinicians operate ethically and some don't. So that's why we're going to be unpacking today, because this episode is not only going to teach us or to teach you all as listeners on how to verify whether your therapist, counselor, or practitioner is legally licensed in their state, but also how to officially find the verification websites across the United States. Because this is about you protecting yourself, not questioning care, but confirming safety, most importantly. But we're going to get into all of that. But today we're really going to focus on is why verifying licensures or why license verification matters. So essentially speaking, why license verification matters is because it lets you know that a license, that means that the provider has met the educational, supervised hours, and legal requirements. Not only does that mean that they did the work, they also proved that they went the extra mile and made sure that someone else checked their work. It's almost like if you worked at Walmart, which I have, self checkout host at one point in my life. I had a supervisor. They made sure that I did exactly what I needed to do. If I needed to override a price to match it, they were able to support me in doing that. So I'm familiar with the hierarchical, and I used to be a supervisor in business sales. So I am familiar with supporting individuals, but also verifying and checking their work, most importantly. But most importantly, that I want to really hone in on. If you heard a dog, that's mine. I'm a golden retriever mom. So, yeah, that's my life. But back to it. In addition to the legal requirements, it also helps us to really hone in on that licensing protects clients from harm and unqualified practices, because it's like going to a doctor who's unlicensed, but they're performing surgeries. Now, let's talk about that for a minute. Not only does that put someone at a risk, but you can die, and that person can literally go off to another country and never be seen again. They have nothing to speak to. That's why this is so important that we really talk about this, magnify this, and really take this seriously. And another thing is, anyone can call themselves a coach or a therapist, but not everyone is legally licensed. Many individuals, they take a course that makes them a coach, but their credentials, their history, the level of education that they got. What's the institute? What school did you go to? What certificate did you get? Because even marriage counselors or therapists, they have to have their credentials so that way they're able to really speak to it. And anyone who is proud of their diplomas are going to hang it up behind them when they do videos. When I get my MSW, you already know it's going to be behind me, and I'll hang up every single diploma that I ever have. So, but if you're asked to verify it, you should be ready and willing to say, okay, here is it. A pharmacy technician can't dispense medication without their license. An OBGYN can't perform the levels of medical interventions that they can perform without a license. Someone can help you deliver a baby, but to cut it open and know where to cut, how far to cut, how to pull the baby out, and how to do the sutures and do all of the things, that takes training, that takes experience, that takes knowledge, that takes you went to school. So I say all of this to say verification is a form of self advocacy and not disrespect. It's okay to question your therapist. It's okay to question your psychiatrist or your doctor on their credentials, and it's okay to also look up if they ever had complaints against them, because if there's a doctor that has a complaint of malpractice, or if there's a doctor that has a complaint of being inappropriate with a patient, that is a problem, because that means that the leopard did not, it hasn't changed its spot, it's been the same. And the saddest thing is that when reports are not made, it puts everyone else at risk. So I say all of this to say we're living in a world where it's very difficult and it can be hard to be that one that makes the first call and to be the whistleblower, as they say. But I say this to you. If you don't talk and if you don't speak up, then someone else is going to be put at risk. And then some of us care and some of us don't, and they move on with life. So I say all this to say why license verification matters is because we are living in a time where our licenses or our professions are being questioned by the wrong individuals. God forbid you're knocking at heaven's door or whichever door you're knocking on, and you need someone to help you. Are you going to say that a doctor's license is invalid, or the profession, or question that, or a nurse or a social worker? Every single person is needed. A captain is needed to steer the ship. The sailors are needed to help get the ship running. Every person is needed on a team. So I leave you with these reflections. Do I know the difference between a licensed therapist versus a coach? Do you? Let's look up that question. Let's look it up on the Googler. Okay, so let me share my screen. Okay, now the primary difference lies between their focus and credentials. Let me expand my face a little bit. Hey, girl. So, therapists treat mental health conditions by examining past root causes, whereas coaches focus on actionable, goal oriented strategies for the future. So, for example, licensed therapists focus on diagnosis, treatment of mental health disorders, anxiety, depression, trauma, etc. Credentials requires a master's degree, thousands of supervised clinical hours, and state issued licenses, either an LCSW or an LPC. A coach, setting and achieving specific goals such as career growth, relationships, or general transitions. Credentials do not require formal degrees or state licenses, though certifications from bodies like the International Coaching Federation are common. Do you see the difference? A licensed therapist has their LCSW, which is what I'm going to be sitting for, in addition to me getting my LMSW. I'm also going to sit for my LCSW too, both of them. So if you're a therapist and I'm looking you up, I need to see these. Where's your license number? Where is your credentials? Because I want to make sure that I'm not putting myself at a risk in this way, because I need to know that you study yourself approved and that you actually took the time to make sure that you were ready versus going out there and doing what you're doing. Because even pastors have to do their own form of seminary training, or they take their due diligence to make sure that they study the Bible, that they ask God for anointing and download. They're not just or at least the ethical ones, aren't just going out there saying that everyone is saved, but not doing rebuking at the same time. Because we're humans, we're filthy rags. We don't always get it right. So you have to call it out. So, but you see the difference: a licensed therapist versus coach. Uh huh. So, that is a question that I want you to ask yourself. Is your clinician that you're currently seeing, or are you, if you're looking into therapy, what are you looking for? What do you desire in your coach or therapist? If you don't mind seeing a coach and they're all that you want them to be, okay. But God forbid, and you're trying to figure out, how can I sue this person? How can I make a report? You have to know that there's a lot of gravities in reporting someone with a license. If they're found to be malpractice, they can lose it. If it's a coach, what they can lose is their credibility, but they can move to another state and continue. A license, if there's a ding against someone's license, it stays on them, or they can have their license revoked. So you see the difference between the two. So the second question is, how have I ever checked a provider's credentials before starting care? So let's go back to the Googler, because I don't want to get into looking for licenses yet. I want to graduate to that level. So, as far as that is concerned, to determine if you have checked a provider's credentials in the past, you can take the following steps. Review your personal records, either old emails, patient portal messages, physical files, or notes or printouts regarding the doctor's background. You can check or browse history on the web. And you can even do a background check if you feel that you need to. Also, the easiest way to also check your provider's credentials going forward is you can also check the state medical boards, as well as the national provider identifier, hospital or clinic websites. If you have a provider, all of that will be public knowledge. If it's hidden, get up out that chair and run. Make that report quick, because all of that would be public knowledge. If you want to know their backgrounds, you can check it in the World Wide Web. If you want to know their credentials, it is free and clear for you to look that up. And even in your insurance provider, I know that there is a portal that they are able to actually, some list their license numbers. You can copy it and still check it to see if it's good. And some actually, if you look up, as long as you have the first and last name, you can look it up and you can find it. So I say all of that to say is, we have to do our due diligence to make sure that we stay safe and our loved ones stay safe and our children stay safe, most importantly. And lastly, before we conclude, is what makes you feel safe enough to open up in therapy? I'll leave that question to you, because what makes us feel safe is different things. It could be the relatability. It could be they may look like you. They may have the same religion as you. They may have the same interests as you. But what should make us feel safe is that we're being respected and heard. Like, if I speak, can you repeat back everything that I just told you to prove to me that you listened? There's different levels to it. And I think that's something that we have forgotten about along the way. So it is my hope that as you start and as you listen and watch as we go through this podcast series, is that you see why a license verification matters, but also why I'm holding your clinicians accountable is crucial, because 4 years, student loans, or your parents probably paid for you to go to school. You're not in your position just to say that you have it or just to be cute. You're in that position because you hopefully did all of your work yourself, but you did the work, you got the license. So now it's time to actually be the doctor and stop being Quincy. Nothing against Quincy, but we need the MD, the real thing. And a doctor is like unto a pastor, is like unto a healer. Do your job with integrity, because you hold someone's life in your hands. either if it's mental health, either if it's physical, either if it's all spectrums. So I hope that this video has been supportive to you. And most importantly speaking, I hope that you took that moment to reset and rest. And most importantly, support exists even at times like this, even when there's a lot of noise and we're trying to balance ourselves and we're trying to figure out what is what. And it's hard, but I hope that this video resonates with you and take what resonates with you. Move gently with yourself from here on out. And I'm your host, Aisha Insa. And until next time, be kind to your mind. Keep choosing yourself one moment at a time. And also take care of yourself because there's only one of you. And we need you. Yeah, we need you. We need us. But don't forget to like, share, and subscribe and comment on how this video has helped you in rethinking therapy and also looking at the credentials of your clinicians because we need to start checking the receipts. We need to get the receipts out, start looking, making sure that we're being handled with care and respect. Amen. See y'all in the next episode. Bye now.